Hi everyone, my name is Sandra Nguyen and I will be doing my disease report on the smallpox vaccine. So first I want to talk about the actual smallpox disease that ravaged the earth for about 3,000-ish years. So some street names that I found included the variola, the pox, the speckled monster, and the red plague. And just a little fun fact, the word variola was derived from the Latin word varius, which means spotted. Pox was derived from the word pock, which means exanthemus disease. And in the late 15th century, writers started adding the prefix small to distinguish variola from syphilis, which was called the great pox at that time. Thus, the name smallpox was created. So this disease was one of the most deadliest before its eradication in 1980. Smallpox had a mortality rate of about 30%, but 80% in children. And according to the CDC, there's been an estimated 500 million cases just during the 20th century, and about 5 million deaths per year just in the 20th century. So just imagine 3,000 years under its belt. Crazy. So now I want to talk about the infectious agent, which is variola virus, which comes from the genus Orthopox virus. And other members of this genus includes vaccinia, which is the virus used in the modern smallpox vaccine, monkeypox, cowpox, horsepox, camelpox, skunkpox, raccoon pox, etc., etc. There's lots of animals. And the family is Poxviridae. Some of the actual characteristics of the virus. It's double-stranded DNA, it's fairly large, it's brick-shaped with an envelope, has a concave core and two lateral bodies. So the reservoir is humans. Transmission can be airborne up to 6 feet, contact through bodily fluids, or a vector such as bedding. The route is through mucous membranes, especially through the respiratory tract and the eye. So we have like two main strains that causes very different symptoms. So we have variola major and variola minor. In variola major, we have 4 different kind of manifestations of the disease, which include ordinary, modified, flat, and hemorrhagic. In ordinary, it's about 90% of all smallpox cases with a 30% mortality rate and 80% in children. And it has that hallmark macular-papular rash and a high fever. Then we have modified, which is mild and usually occurring in previously vaccinated people, and it has a few lesions that are usually superficial and it's rarely ever fatal. We also have flat, which includes the extensive lesions that is like flush with the skin with little to no fluid, and it has a high and prolonged fever, and it's almost always fatal. Lastly, we have hemorrhagic, which includes extensive bleeding into the mucous membranes and the eyes and the GI tract. And there's no specific lesions or anything, it's just the bleeding is occurring under the skin. And although this only consists of 2% of all smallpox cases, it has a very high mortality rate. Then we have variola minor, which is just a less severe form of the ordinary variola major. Next, I want to talk about the progression of smallpox. So this includes an incubation period that can last between 12 and 14 days where an infected person may be asymptomatic or have similar symptoms to the common cold. So after these initial symptoms arise, over the next 2 to 4 days, the patient will have high fever and other serious URI problems. Over the next 4 days, patients will develop a rash that starts in the mouth with red spots that then spread to the throat, the face, the trunk, and the extremities. And at this time, the infected patient is contagious. The rash will then progress into raised bumps that are filled with this thick liquid or fluid, and a depression is formed. That's the hallmark rash. After this stage, the rash spots will turn into pustules where the bumps feel hard like a ball under the skin, and these pustules will then develop into scabs, which then fall off, leaving a scar. And once all the scabs fall off, the patient is no longer contagious. So next, I want to talk about the history of smallpox, specifically leading to the eradication of the disease. So early smallpox cases were observed when smallpox-like bumps were found on Egyptian mummies. This then traces the disease back to about the 1350 BC. Smallpox was then spread across the globe through colonial expansion. And in 200 BC, variolation was first documented, where very minimal amounts of the scabs were introduced into a healthy person, which resulted in a milder form of the disease and a lower mortality rate of smallpox. Then in 1550, China begins insuffiation, which is a method to introduce the smallpox scabs into a healthy person, where they would take scabs and dehydrate them and ground them into a really thin powder and then blow it into somebody's nose with a straw. In the next 20 years or 200 years, variolation was the main mechanism to slow the spread of smallpox. Then in 1796, Dr. Edward Jenner observed that milkmaids who had been in contact with cowpox were immune to smallpox. So he placed a cowpox scab into a laceration made on an 8-year-old. Then 2 weeks later, Jenner inoculated smallpox into the kid and he did not develop any symptoms. So this is the first vaccine in history. Then in 1880s, the process of variolation was spread to other parts of the world, and during this time, instead of inoculating cowpox, the vaccinia virus was used instead. Then from 1952 to 1977, smallpox was erasing from the face of the earth thanks to the vaccine. First in Europe and the US, and ending with the eradication of smallpox in Africa. Then in 1980s, the World Health Organization declared smallpox as eradicated globally, and this was the first of 2 to be declared eradicated about 30 years before Rinderpest in 2011. So the eradication of smallpox is considered to be the greatest public health success story in history, which is pretty cool. Very cool. Then we have some vaccines. So we have the first generation vaccine, second generation, and third generation vaccines. So the first generation vaccines were made by growing live vaccinia virus on the skin of cows and other animals like sheep. And the development of freeze-dried vaccine in 1950s extended the unrefrigerated shelf life, which is very important. And this is administered through scarification, which I'll talk about a little later, and consisted of live unattenuated vaccinia virus. The second generation vaccine was made by growing live vaccinia virus in a membrane or a cell culture, and usually they would use an egg. And this was also administered through scarification and consisted of live unattenuated vaccinia virus. Then we have the third generation, which consists of attenuated vaccinia virus. Now, attenuated means that it has a reduced virulence, and this is done by serial passages in non-human cells or by careful deletions of genes in the laboratory. Now, this results in a vaccine that is less virulent and carry lesser side effects. So the third generation is a fairly recent development, but it's impossible to prove the actual efficacy of these diseases since smallpox was eradicated and no animal model would accurately represent this human disease. So some examples of this third generation smallpox vaccine includes modified vaccinia Ankara, which has been tested on various human trials, but there's no market for it currently, which is a good thing, I guess. So here are the 3 available smallpox vaccines in the USA that is stored in the SNS, or the Strategic National Stockpile. So this includes ACAM 2000, Genius, and APSV, or Aventis Pasteur smallpox vaccine. All of these use vaccinia virus, and while these are not given to the general public anymore, they're available for medical professionals or lab workers who can become in contact with a virus or a similar virus, and the vaccines are primarily kept for a potential outbreak and fear of bioterrorism. So ACAM, its schedule, it's 1 dose through scarification with a booster every 3 years, and it's a live replicating vaccinia virus. In Genios, it has 2 doses plus boosters every 3 years, and it includes live attenuated, non-replicating, modified vaccinia virus. And lastly, APSV, it's only 1 dose via scarification again, and it's live replicating vaccinia virus. Next, I want to talk about scarification, which is the actual administration of the vaccine. So this is administered through multiple punctures in a circular motion on the skin, usually the left arm, with a bifurcated needle that holds a vaccine solution in the fork. So bifurcated needle is just a double prong needle, and with this, the smallpox solution can just remain there and be entered with each poke. So many of you are probably some of you maybe are probably familiar with the scar. I know my parents have it, and this is the result of scarification from the smallpox vaccine. And since the vaccine is a live replicating vaccine, this allows for contact immunity. So now we have some adverse effects of smallpox vaccines. This includes heart problems, And this could be myocarditis, pericarditis, myopericarditis. We also have eczema vaccinatum. And those with pre-existing skin conditions, such as eczema, are more likely to develop a very serious rash around the vaccination site. Then we have progressive vaccinia. So those with a deficient immune system are at risk for serious inflammation around that scarification site, which we can see in that poor baby photo. After this, we have post-vaccinal encephalitis, which is just the inflammation of the brain. It can also cause eye problems such as blurred vision or even blindness if the solution is gets into contact with the eye. And lastly, we have fetal vaccinia, where the vaccine in pregnant women can infect fetuses, causing stillbirth or infant death shortly after delivery. So now I want to talk about anti-vax movement of smallpox. So anti-vax movements has been as old as vaccination. So I think it would be kind of fun to talk about some of the public perceptions of the vaccine. So while smallpox variolation was very successful in reducing the mortality and the morbidity rate and also lessening the symptoms, anti-vaxxers were still very wary of the serious uh, adverse effects. So the serious but non-life-threatening reactions happen in about 1 in 1,000 vaccinated, while life-threatening reactions occur at about 30 per 1 million vaccinated. Anti-vaxxers at this time also believed that inoculating animal matter into healthy humans, especially children, was unchristian. And some propaganda even went as far to say that administering the vaccine to children will cause them to turn into a cow with like bovine features and sprout horns and grow hooves. It's crazy. And many were also against the vaccine due to the mandates that would eventually lead to its eradication, but nobody wants to be told what to do by the government, apparently. And here are some more anti vax smallpox propaganda that I thought were amusing, where this lady is like, no, I don't want it. That's not my child anymore, but it's a cow. And then here they're feeding babies to a cow with cowpox and it's coming out of its butt. Okay, thanks. I feel